Higher rates of stroke have been considered as a limitation of transcatheter aortic valve replacement in comparison with surgical aortic valve replacement. Stroke following TAVR has been shown to increase the 30-day mortality from 3.7% to 16.7% according to a retrospective report from STS-ACC Transcatheter Valve Therapies Registry. The registry had 101,430 patients who were treated with femoral and non-femoral TAVR at 521 US hospitals between 2011 and 2017. A previous study had used cerebral embolic protection device in 280 of the 802 consecutively enrolled TAVR patients. The use of cerebral embolic protection reduced the rate of disabling and non-disabling stroke from 4.6% to 1.4%. The analysis was by a propensity score matching to account for possible confounders. Protected TAVR trial enrolled 3,000 patients across North America, Europe, and Australia. A cerebral embolic protection device was successfully deployed in 94.4% of the 1,489 patients in whom it was attempted. The incidence of stroke within 72 hours of TAVR or before discharge was not significantly different between those who received the cerebral embolic protection device and those who did not, 2.3% versus 2.9%. Disabling stroke occurred in 0.5% of the cerebral embolic protection group and in 1.3% of the control group. There was no significant difference in the mortality, transient ischemic attack, delirium, or acute kidney injury between the groups. One patient in the embolic protection group had access site vascular complication. Authors concluded by saying that though the use of cerebral embolic protection device did not have a significant effect on the incidence of periprocedural stroke for transfemoral TAVR for aortic stenosis, on the basis of the 95% confidence interval around this outcome, the results may not rule out a benefit of cerebral embolic protection device during TAVR. First set of journal references. Second set of references. Thank you for watching this video. Please subscribe, like, share, and post your valuable comment below this video. Kindly press the bell icon after that for getting all updates.